Let's now discuss diagnosis by four phases. Diagnosis by the four phases for warm illnesses was an approach devised by the Qing dynasty physician Yi Tianxu for the analysis of warm illnesses caused mainly by exogenous heat evil. These phases, defensive, qi, nutritive, and blood, signify four stages in the course of an illness and reflect four levels of severity as the exogenous evil progresses from the exterior to the interior. Exogenous heat evil enters by the mouth and nose and first attacks the lung. It moves progressively from the defensive to the chi phase, from the chi to the nutritive phase, and finally from the nutritive to the blood phase. As the pathogenic evil invades more deeply, the illness also becomes more severe. In this way, the illness characteristics of these four phases signify the depth of heat evil, the degree of severity of the illness, and the state of its pathological changes. When the pathogenic evil is in the defensive phase, the illness is least severe and is in the exterior. The principal organ and tissue affected are the lung and body superficies. When the illness is in the chi phase, it is at a somewhat deeper level and at a somewhat higher degree of severity. Here, the pathogenic evil has entered the interior and is affecting more organs and tissues. The chest and the diaphragm, the lung, the stomach, the intestines, the gallbladder, or other organs. When the pathogenic evil enters the nutritive phase, the location is another step deeper. The disease evil has now entered the heart and the pericardium, so that the mind is disturbed. When the illness is in the blood phase, heat evil is in the liver and the kidney, in severe cases impairing and consuming blood and making the illness critical. The following describes the basic pathology and clinical manifestations as an illness progresses through the four phases. We will first discuss the defensive phase. An illness is in the defensive phase when the heat evil has just attacked the lung and the defense phase. So the defensive chi action becomes disorganized and lung chi movement impeded. It is an illness of exterior heat. The typical syndrome of an illness in this phase includes fever, mild wind and cold aversion, sweating, a tongue that is red along the sides and in the tip, and a floating and rapid pulse. Other often accompanying them are headache, thirst, coughing, and sore throat. Thank you for your attention.